There we go. Now it says recording up top. I'm laughing here because of all the dates and times that could possibly happen. I have a siren or something going off outside the window, which was not in the script for today. But hey, it's a Friday. We're all just gonna roll with it.
Yeah, that's how it works with work from home. You never know.
Who'd have thunk when we started this 16 months ago that we'd still be doing Zooms all day 16 months later? I remember when they first started this, quarantine stuff. It's like, maybe a month or two, everything should be back to normal. Here we are 60 months, and frankly, never going back to normal. I mean, I think, travel is going to pick up, in person is going to pick up, but I think the new normal is going to be very different.
Yeah, I remember my wife and I think last March making a bet, like, how long is this going to last? And I think I bet like another 2 months. And she was like, oh, no, you're crazy. It'll be 3 months. So we're both very, very wrong about that.
I think we were all wildly incorrect. Well, hey, I think people are still joining here, but in the interest of time, I know that it's the lunch hour. So people are trying to eat, trying to wrap up their day, wrap up their week, and kind of get ready for the weekend. So, Rohit, how bad is that siren in the background? I'm sure it won't last here. Can you guys hear that?
It's not too bad. I think we should.
Yeah, it's not too bad.
Okay. Well, I'll just give a quick intro then. If it's too loud, let me know, and I can always I'll try to go on mute here. So thank you all for joining. This is the third or fourth installment of Coffee House. We kicked this off, kind of starting this year. Couple ideas in mind here. Everybody seems to be kind of pursuing content strategy. It's not really just about creating content for the sake of content, though. What we wanted to do is kind of inspire entrepreneurs and give folks a chance to kind of real talk, behind the scenes type of stuff. And Will Boeglin and TimeDoc is one of our favorite companies, one of our favorite stories, really, because when we first met Will, it was a much different company then, as you'll hear as we go through the story. So the goal here is to, a little bit of education, anybody that's curious about what's going on in telehealth, what's going on in chronic care management, really to inspire, other potential founders, and then kind of learn. Some folks are also maybe between seed and Series A, or kind of getting to the revenue stage, wanting to understand what it's like to scale a telehealth company, kind of healthcare IT. Tech-enabled service is an interesting topic because it can scare certain VCs. But as we've found, especially in the case of TimeDoc, it can also be incredibly lucrative and can scale very nicely. So thanks, Will, for joining. My colleague Rohit's on as well. He's the kind of resident healthcare IT guru on behalf of Grand Ventures. So we asked him to join in and ask some thoughtful questions. I don't remember how this works. We're doing this as a webinar, so most will be the three of us. I think there is a chat room though. So as we're going, if there are questions, feel free to drop questions into chat, and we'll try to integrate those into the conversation. And this is gonna be fun. We'll probably go half hour, 45 minutes, and then we'll get you all on your way and off to the weekend. So thanks again, Will, for joining, and welcome to Coffee House. It is May the 7th at about noon. I don't really think I have any other plugs other than stick around to the end, because TimeDoc is hiring and growing super, super fast. So there's also an element here of telling you about TimeDoc, and we'll have some sort of call to action here for folks. Maybe we can try to do a plug at the end, Will, for some of the open roles. But thank you all for joining me.
Great. Thanks, Tim. Happy to be here.
So let's go back in time. Give us even the timestamp, because I want to know kind of how times evolved. But what led to the founding of TimeDoc? Take us back to the light bulb moment. Take us back to the early days. Kind of, where were you? What was the light bulb that went off?
Yeah, so I would say that there've been really two light bulb moments for TimeDoc. As you kind of alluded, the company's changed a bit since the time that you and I first met. But the first light bulb was the idea for our minimum viable software product. And that's what we were scaling up when we first met you. The second light bulb was when we came up with the idea to build a truly differentiated tech-enabled service. But we'll start with the first light bulb, and I cannot take credit for that first light bulb. That
Sure.
was my good friend and co-founder, Kurt Ginder, who was a medical student at the University of Chicago. And this was back in like late 2014, early 2015. Kurt was working at a clinic as a part of his medical school at University of Chicago. And at that time, Medicare had just released this new reimbursement program called chronic care management. And for people in the industry who were really kind of in the weeds of primary care, it was a really exciting opportunity because for the first time, Medicare would pay a primary care physician, not just for the time that she spent with patients in person in the office doing a regular doctor visit, but all the time spent outside of those visits when the patient's at home or, you know, in transition from the hospital or long-term care, all the time that the doctor would spend and her clinical staff, like nurses, would spend to coordinate that patient's care, help manage their medications, appointments, talk to their specialists. There's a ton of work that primary care providers and their teams do outside of the face-to-face visits. And for the very first time, Medicare would pay doctors directly for that work. So the clinic Kurt was working at treated pretty much exclusively elderly Medicare patients with multiple chronic conditions who needed a lot of that kind of extra coordination. Kurt has a bit of a tech background, and the head doctor gave him a project to go figure out how can our clinic start this chronic care management program, start, you know, getting credit for the work that they were doing and get reimbursed for that work. And Kurt, you know, being pretty technical, was working in their electronic health record system, Epic, and trying to figure out the workflow of how they would identify these patients, how they would enroll them, how they would document and track the time they were spending on these newly reimbursable activities, and then bill Medicare. And pretty quickly realized that it would be so difficult to do that. And doctors already hate documentation. And so, like, if you can't create a really seamless way to document this work, even though they could get paid for it, they just wouldn't do it. And so he had that light bulb kind of went off. And, you know, he was working with another med student who had some experience using text extraction. So pulling out free text out of the electronic health record system, and then kind of parsing that text for certain data points, structuring that information in a different system to make sense of it. And they saw a use case to leverage text extraction here to let doctors really easily say, oh, I spent 10 minutes managing a medication or 20 minutes talking to a patient on the phone, in kind of the natural places in the EHR where they already document this information, and then extract that text, structure it to really track time in an organized way for the purposes of billing. So that was the original idea for the minimum viable product. That was the light bulb. Yeah. Of course, it took a year before we ever really developed the solution and proved it out, but that was the original light bulb that caused him to reach out to me and say, hey, I've got an idea. Let's see if we can get into the new venture challenge at the University of Chicago with this idea.
And hence the name, right? Because some people look at it and they're like, what does TimeDoc mean? What is a TimeDoc? But a lot of this was around kind of tracking and documenting the time, right?
Exactly. That's how we got that original name, is it was all about making it as easy as possible for doctors to document and track the time they're spending on these virtual care coordination activities.
So for founders listening, it's a pretty cool story because, like I said, this was a couple things here. Then this is kind of textbook startup, but you had a regulatory change. There's this new billing code for chronic care management. You had, at least as an investor, we love this. We had the technical founder, an MD who was actually in practice, needed to solve this and didn't have a solution. And then, he had his tech savvy entrepreneur friend, Will, who was actually like in a different city doing something totally different. But one of the catalysts here also, just to plug my alma mater, this was the University of Chicago New Venture Challenge. So this literally coalesced to start with just in like a business plan for the New Venture Challenge. And I don't know if we have any booth folks on the phone, but it's kind of cool to think that this started, kind of in the halls of the University of Chicago as part of the business school. He was an MD. Kurt was an MD, MBA. So let's make this a little bit more real, though. Give us, because there's a lot of buzzwords in there, and there's a lot of words and acronyms that might not mean much to the average person. Give me an example of what chronic care management means, maybe a patient success story or an example.
Yeah, and this has become much more real for our company. So I know we'll talk about this more in a bit, but we've evolved from just a tech platform to tech plus services. So we have over 100 clinical staff members employed by TimeDoc who are involved in providing this monthly virtual care service to elderly chronically ill patients. And we track what we call patient success stories. And it's become, a huge part of our mission and purpose as a company and our differentiation and just the value that we provide. But these patient success stories take a lot of different forms. So we help with, clinical interventions. Say we uncover that a patient is taking 2 different medications that have a potentially dangerous interaction, and we're able to uncover that, get with the doctor and change the medication regimen to avoid a negative interaction and potentially save the patient's life. Other patient success stories, are less clinical. We work with a lot of patients who suffer from depression and loneliness. We had a patient who was suffering from those issues, was also blind, and our care manager is able to get them access to audiobooks that they could listen to provide them some enjoyment, and just through monthly encounters really be there for the patient and have enable the patient to interact with somebody who really cares. Another story that would be described more as social work than clinical that I often share is our care manager was working with a patient and uncovered that he was living in his car at the time and had kind of lost his home and had become homeless. And he needed certain paperwork filled out and authorization completed by the local community health center where he gets care. That wasn't in place. So they were able to reach out to the health center and other agencies to get that paperwork completed and get the patient successfully admitted into the local shelter. And that doesn't seem clinical on the surface, but those are the patients who end up in the emergency room time and time again because they don't have anywhere else to go. And a patient really can't get healthy that way, and we can't reduce costs in our healthcare system unless we address those, what we all often call social determinants of health. So I think those examples kind of explain the breadth of the different types of interventions you can have through chronic care management to make a difference for patients.
Yeah, and I love that, by the way. I didn't expect to cry today. I feel like I'm on Oprah or something. I'm gonna start crying with some of these stories. It's how cool to have this kind of life-changing work that's really impacting patients. But you're right. I kind of glazed over the fact that we started with kind of the light bulb moment for the tech only solution, which was Kurt saying, "Hey, there's no solution here." Calls up Will, and you guys say, they need better technology to do this. But the second gap that I believe you found, you used the word care managers a couple of times. And the second gap, as I recall, you found was, all right, so we can build the tech solution, but there's this fundamental problem. There may not be enough doctors or nurses to actually do this. So go back to that a little bit, because I want to build up to what do you mean by care manager, as well as well, how many do you have today? So talk about that gap in between a little bit, so people connect, because we kind of skipped over the hybrid service part of the business.
Yeah, absolutely. So when this new reimbursement came out, over time, we saw a number of companies come out of the woodwork to address this problem, and they could be categorized into 2 different categories. So there were some companies that they didn't take the same approach as us, but took a technology approach. We're going to provide software to providers that enable them to kind of empower them to get credit for the work they're doing already and provide this chronic care management service through their internal staff. And then you had companies say, no, we're going to solve this problem by outsourcing all of the actual patient care to a team of clinical folks that we employ. So you had a number of like clinical call centers form that came out of it. We were like philosophically opposed to that approach in the beginning because we were co-founded by like a number of medical students who had this just core belief that the primary care physician and her team should be providing this service, and they're providing it to a certain degree, so it should be insourced in that way. But as we worked with more and more medical practices and really got kind of a flavor of, a significant number of them and saw, their ability to scale this service internally. And also as we got more familiar with the competition and the way that they were outsourcing services, we realized a couple things. And the first was that a lot of practices, the majority of practices, have never hired a care manager before. A care manager is a clinical individual, usually a nurse or a medical assistant, who understands the tenets of chronic disease management, but is put into this kind of proactive role where they have a panel of maybe 100 or 200 high-risk patients who they're not waiting for them to reach out with an issue. They're proactively reaching out to them via phone or text on a frequent, recurring basis because they have, really significant issues. Maybe they have hypertension, diabetes, heart failure, COPD, depression, et cetera, take 10 plus medications. So they're reaching out proactively to make sure the patient understands their conditions, understands the doctor's care plan, and is really implementing that, adhering to that. Most practices have never hired that individual. They don't know where to find them. They don't know how to onboard and train them and make them effective. And in order to make CCM successful, you really need dedicated, time from an individual like that to provide a proactive service. We also came to believe that the vendors in the space outsourcing this kind of care were providing a really crummy service. They were billing for, instances where they never spoke to the patient. They were hiring sometimes non-clinical individuals to provide this service. And they're really taking like a call center approach where, the patient might speak to, 20 different people over the course of a year. It wasn't a dedicated staffing model. And so we saw, if we're going to really help our practices be as successful as possible and reach as many patients as possible in a valuable way, we need to, kind of bear hug this issue and help them figure out the staffing piece. So, it was a really big decision, and I know we want to dig a little bit more into that later on, but just on a high level, we decided to start scaling that up and now have over 100 clinical care managers in our organization who work as a virtual extension of the practice, providing this service month over month.
100 care managers. And do you remember how many did we have back when you and I first met?
At that point, we probably had around 5 to 10, I would say.
Yeah, it was a new. I love that you used the word bear hug when you talked about the care managers. That certainly is how we feel about them. I mean, the care managers now are like really the heart of the company. And Will's done a great job kind of sharing almost pretty much like weekly emails about like, hey, here's a patient success story this week. And really the care managers make it all take. But the bear hug part is particularly relevant because I remember in the early days, I don't even think we had invested yet. And it's just like, let's talk about tech-enabled service because service is the heart of this, but also is scary to VCs. And I remember like, oh God, what do we do? Because we could have gone with the SaaS only product, and we thought about that and talked about it a little bit. But I remember we kind of said, I think we just need to embrace this. Like this care model really seems to be what both the practices and the patients need. And rather than hide from this, maybe we kind of make this our core. Maybe we kind of, and by the way, I don't have any other business that's ever done this. Any other business where like we say, hey, let's take the ugly part, the quote unquote ugly part of the business, the service piece, and actually make it our differentiator. Let's make it the heart of the business. So not only did we just like, okay, we'll keep it, but we said let's really embrace this.
Yeah.
Do you recall those days? You know, what was the consternation? What was the kind of the VC feedback? Obviously, I was one and I got there, but what was the VC feedback about this, or investor feedback about this service model?
Yeah. Well, as I mentioned, it was a very pivotal decision for us. So, before fundraising, just internally, there was a lot of debate amongst the co-founders on whether we should go down this road. And I mentioned part of it was philosophical. We'd kind of like staked our claim as you don't need to outsource this. We can help you do this successfully on your own with our technology. We kind of already staked our claim there. And then the other part of the debate was really just about, profitability, scalability, valuation, that kind of thing. Obviously, we knew it would be harder to scale services rapidly, right? And we knew that gross margin would decrease and that would potentially, hurt the valuation multiple. And that was a big part of the conversation with investors too. But at the end of the day, what it came down to is we just couldn't deny that like the thing that we knew was true in the marketplace working with medical practices, as I mentioned, they just don't have that expertise. And so much of the vision of chronic care management and what Medicare intended is to really provide this more proactive, continuous care management service to patients who need it. And that's what's going to prevent hospital visits and get, patients healthier and really go from a very reactive kind of fee-for-service healthcare system to a proactive, value-based, trying to prevent issues from occurring. And we just knew deep down that this is what was needed to make practices successful. And I think, talking to investors, we were able to show how when you implement with a practice using our services, you can scale top line revenue so much faster. And you can add so much more value that drives client retention and patient satisfaction. And I think another really key thing is we were able to demonstrate how critical the core technology was to, making the product successful, to our differentiation, to driving scalability over time. And regardless of what we did, the core problem in the industry was that you have to figure out how to make care management effective and scalable. And so we felt like by embracing, the people problem head on and saying, we're going to figure out how to recruit great care managers, how to onboard them, how to train them, how to make them effective and scale their reach to as many patients as possible. Like we're solving that problem head on, and it's going to be easier to do that when we know what it means to be a care manager than trying to develop software and process kind of in a silo. And so I think ultimately, investors, enough investors, including you all, kind of saw that and understood how that made sense.
That's great. Yeah. And, I remember there was also a math aspect to this too. So I met Will and Kurt and Chris, and a lot of VCs had said no. And I'm like, you always need to worry about adverse selection in venture world. I'm like, a lot of other people have seen these guys. They came out of New Venture Challenge. Like a lot of people have seen this. Everybody said no, but I was like, no, I just think there's something here. And I remember I looked, I'm like, this is a 3-person founding team. And this was a skeletal team when we first met Will. And we thought about the SaaS version, and the SaaS version, hey, we could make, a couple bucks per month per patient or whatever it was. But then the reimbursement, if you're actually providing the care, is much, much higher. And I'm watching these 3 guys, who all are like so young in the grand scheme of things, or so it seemed. I'm looking at their contracts, I'm like, you're landing $50,000, $100,000 clients like several $100,000 clients. I'm like, these guys have never even barely raised capital. None of them really have healthcare sales experience or limited. And they're just winning these monster contracts. And so that let's be honest, like that also sort of like, all right, not only do we need to do this, but it actually, scales really, really well. And so I just, I call it out just for entrepreneurs that are having the same kind of internal moral debate about, kind of service versus tech only. You need to kind of listen to the product and kind of, or listen to the market and see product market fit. But you also just need to think through the economics of it. If you want to keep, 10 cents per instance or $10, and obviously it's probably not that market, but think about the real economic impact as well here. So we talked about chronic care management. I want to go a little deeper in terms of that's kind of where we started. I know we're going other places here. Roy, you've been kind of spearheading some more research. Maybe you can walk Will through some questions about kind of the market, the industry, and stuff like that.
Yeah, I mean, I would love to just hear, or if you could walk us through kind of, you talked about how, initially the Medicare code was brand new and you were kind of first to market, and then you built the further differentiation around kind of leaning into the services component. I guess the next question is what's next in terms of building, continuing to build moats while, everyone sees new players entering CCM all the time?
Yeah, that's a great question. I mean, it's something we think about all the time. At this point, we've got about 60,000 patients enrolled across our client base. And, I think the pandemic was a really good catalyst to help us expedite some of our plans because, we look at what percentage of these patients have a behavioral health condition. So, and then this grew significantly during the pandemic. I think around 20% of Americans suffered from depression before the pandemic, and that doubled during that time. And so we ran our own numbers. About 40% of the 60,000 patients we work with suffer from depression. And we, as a part of what we're doing with chronic care management, we're already talking to them about that, to a certain degree, doing some depression surveys with them over time. We decided, that we need to lean into this. And like in a lot of ways, you can't address someone's diabetes until you address their depression. And so we hired a behavioral health expert to come in and help us build out, all the kind of soup to nuts content and programming for how we could uptrain our care managers to more comprehensively monitor and manage a patient's depression and anxiety. We really targeted those two behavioral health conditions to give some more teeth to the way that we're doing that, so we can make recommendations to the provider if the patient needs therapy or medications, et cetera, and really monitor the patient continuously and hopefully get them to a point of remission with their depression. So that was one. This behavioral health focus was a big thing for us in the past year that we've uptrained the majority of our care management staff on. The other really big exciting thing is remote monitoring of certain conditions like hypertension and diabetes. So, talking with our clients over the pandemic, a number of them started reaching out and saying, hey, we're interested in getting out these remote monitoring devices like a blood pressure cuff or a blood glucose monitor to our patients. You're already talking to them every month and managing them through this chronic care management program. Could you help us with this? And could we use your software platform to track the remote monitoring aspect for these patients? So this was already on our radar, but it really expedited things. And as we spoke with doctors, the use case became so clear. A primary care physician doing a telehealth visit with a patient who has uncontrolled high blood pressure cannot manage their medications and titrate their blood pressure medication if they don't have some data points to see, what their blood pressure is now. At least, I mean, historically they would get one data point in the office, which wasn't a great situation anyway. But in telehealth, they're operating with no data. And if you can get a patient a smart enabled blood pressure cuff, that will get the provider the data necessary to make better decisions and really help that patient manage their condition. So after quite a bit of research, we tried to think about partner versus build. We spent a lot of time. I mean, my apartment is full of blood pressure cuffs and blood glucose meters, just trying to figure out how we want to go about doing this.
Nowhere to go. Is that Will's got boxes of blood pressure cuffs?
Tons of boxes. I actually take my blood pressure every day with multiple devices, just because I believe in it, and it's so important from a product perspective to understand what the patient experience is like. We ultimately decided, when we looked at the competitive landscape and we looked at the value proposition, we're in a position to do RPM in a more comprehensive way, in a more seamless way than anybody else in the marketplace for providers. And so we've launched this service recently. We've seen more demand for it and closed, more deals in RPM in a short amount of time than we have for chronic care management or behavioral health care management. And so it makes a ton of sense.
Yeah, that's awesome. Could you kind of dig a little deeper in there as to why you think the CC or the chronic care management core business has positioned you really well to win in remote patient monitoring? And maybe just clarify really quickly for anyone, like the difference between the two acronyms, basically.
Yeah. So while chronic care management is about providing very general coordination of care for a patient with multiple chronic conditions, helping with med management, appointment management, education on conditions. It's kind of disease agnostic. It's like really whole person care. Remote patient monitoring is getting a patient who's diagnosed with, say, hypertension, high blood pressure, or diabetes, one of these peripheral devices that they use at home, ideally on a daily basis. And the data is automatically transmitted to a software platform, and someone is reviewing that vitals data, the blood pressure data, the blood glucose data on a frequent basis, so that they can intervene in real time if a patient's blood pressure spikes to prevent, a hospitalization. That's remote patient monitoring. And, we believe that we're in a really strong position, partially because we already have customer base, the same medical practices that are eligible to do chronic care management are eligible to do remote patient monitoring, and the same patients qualify for both programs. And then we've already built the kind of comprehensive service around enrolling and onboarding patients. We have the software platform, the virtual care management tool that's already integrated with the doctor's electronic health record system and sending them information. So we have that plumbing in place. And then we have the care managers who can engage patients every month. And with remote patient monitoring, what we learned is you can only be successful if you can get the patient to use the device initially and then ongoing. Like getting them to check their blood pressure every day is critical. And it's hard to do that, if you're not interacting with the patient in any way. So we've really had the kind of three components already built. It was just about adding on some extra functionality and fine tuning them for RPM. And we've been able to start rolling it out within our existing client base.
Awesome. And then what was I know you guys are doing all of this kind of in conjunction with the fundraise. So you were balancing going into new areas while trying to raise money. What was the process and decision-making around prioritizing kind of the core chronic care management business while also trying to expand to these other areas and also trying to fundraise at the same time?
Yeah, it's definitely not easy. I mean, I think with chronic care management, we had developed something that was pretty repeatable. And, we had our sales team and our implementation teams just focused on, that kind of flywheel of bringing in new business so we could demonstrate growth. And we also view that as like or a way to onboard patients, the patients who are ultimately going to receive all three services, CCM, behavioral health, and RPM. The best way to onboard them is through chronic care management. So RPM really represents, like, it could be a great new business product, and we've been selling a lot of new business through it, but it's a great upsell as well. So we wanted to keep generating new business through chronic care management and, you know, developing the product through some pilots with existing customers. That was a really big advantage we have, is that we could go to a practice and say, we want to get devices out to 20 of your patients who we're already working with. So it's kind of like the R&D piece of what we're doing in the background as the kind of go-to-market sales engine keeps closing chronic care management deals. And then with fundraising, I mean, you just have to find the time on top of it all to do. So.
Yeah, makes sense. And then would you say, like, the market kind of now demands that you have like all of these three things plus maybe more to make a successful sale? Like, is the general demand for, I guess, like comprehensive solutions, or are kind of healthcare providers still kind of buying CCM or RPM or behavioral health solutions kind of on their own?
Yeah, I think it's definitely moving more towards a comprehensive solution, and the pandemic really accelerated that. I think, you know, the kind of array of products that a provider would purchase before the pandemic was fairly broad, and they would look at point solutions, but the pandemic really forced them to kind of ruthlessly prioritize their initiatives and the problems that they're trying to solve. And I think, you know, getting really pointed about how am I managing this patient with uncontrolled hypertension? I have to have data, I have to have information, really clarified the value proposition for RPM. And also it connected the dots between chronic care management and RPM. They're so similar, so related. You know, if there's a solution that does both, you know, that's a really, really attractive compared to one that can only do one of those two things.
Yeah, this kind of fits into one question we have from the audience around the consolidation of just, you know, the question was from Anna about the proliferation of digital health companies and how you see kind of the market evolving and consolidating. Do you think, you know, this kind of consolidation that you're seeing is going to continue across the industry?
Yeah, I mean, I think there will be a good amount of consolidation. There are so many companies entering these, you know, kind of chronic care, remote monitoring space. Now, healthcare is interesting. You can have two companies that appear to be doing the same thing and appear to be going after the same market, and they're actually not. They're doing, you know, fairly different use cases under the same acronym umbrella. And they're, you know, like, for example, you might do some remote monitoring that's really focused around the period of time after which a patient is discharged from the hospital. And they're really trying to prevent readmissions into the hospital with remote monitoring. That's actually very different than what we're doing, which is much more longitudinal. So you can get companies that appear to be doing the same thing, but are really doing different things. And they're also targeting different segments of the market, maybe payers versus providers, or self-insured employers versus payers. So there's a lot of noise out there, a lot of companies doing semi-similar things. But, you know, in healthcare, to a certain degree, like, you have to sell one client at a time and implement one at a time. It's kind of hard to just get like mass adoption across the country all at once. So you get a number of companies that, you know, build up their client base over time. And I think, as we've seen in other parts of health tech, like, you will see some consolidation, and that's how, you know, you get really, really massive size companies in some of those spaces.
You mentioned patience. Will is so reserved and understated, just like patient and humble. and then in a board deck you put in like the 5-year goal. Will, how big does this get? Because I love the 5-year goal, of course. How big do you think this business can get?
So the numbers are pretty crazy. I mean, there are 150 million Americans with, suffering from a chronic condition right now. When you just look at the Medicare population alone, the numbers are crazy. What you're referring to is our BHAG, our big hair audacious goal. Ultimately, 5 years from now, we want to be helping 1 million patients a month. So, it's a big goal over the next 5 years, but it's not an unrealistic or big goal for TimeDoc in general. There are so many more patients than that need this kind of service and aren't receiving it. Most, 90% of patients out there are not receiving CCM or RPM. So there's just so much green space to expand. So there's a lot of room to make this a huge thing.
Now we've got it recorded, so let the record show. All right, so we've focused on some awesome stuff here, and one of the things that I'll call out, again, this kind of gets back to the idea of tech-enabled service, like where do you do it, where do you not do it? One of the hypotheses here in the early days where there's like this pull demand in CCM. It's new, nobody's doing it, or nobody's doing it right. We're going to embrace hybrid model. But the thought was always, this could be our beachhead. And I can't tell you how many decks I see that. It's a land and expand strategy. But in this case, we've actually landed and expanded. So there's a little bit of sort of a, kind of good fortune and great execution involved here. So kudos to Will and to the team for executing on that and really listening to the market. But not everything is a straight line and not everything goes well. So I do want, again, for the sake of founders that are listening now, or we'll listen to the recording later, what advice do you wish you had been given? Because not everything obviously went perfectly. What advice, and you were a first-time founder, like what advice, looking back now, do you wish you'd been given, or would you give to a young founder?
I would say raise more money and spend it faster. And I'm somewhat joking. I don't think that advice applies across every business, but for us, shifting to a tech-enabled service, I just think we underestimated how raising more, investing more in certain areas could drive growth faster. So just by nature, me and the co-founding team were pretty financially conservative, and we're always somewhat slow to spend money, whether it was on hiring faster or investing in marketing. Those are two areas where I think we just underestimated that, if we had invested more, we could have grown faster in those ways. And there were some positives to us being financially conservative. We're very capital efficient. I know that was one of the things you were really, attracted by. I think we spent like $1 million to reach, 3 million in ARR. It only took like $1 million to get to that point, but I think we still could have grown faster if we just spent faster.
Yeah. What you mentioned the capital raise there, and we talked about how this is a lean team. So how did you build the team? Because this is actually an interesting topic. It's probably helpful for founders that are in a similar situation where I love the advice: just raise more money than you need, or than you think you need. Obviously, everybody wishes they could do that, or many people do. In this case, there's the reality: hey, you only had a limited budget or a limited capital raise. So how did you think about building? What were the keys to your success there, knowing that you couldn't go out and hire everybody? You couldn't hire everybody you wanted all at once.
Yeah, I mean, I think it's the typical startup situation where, we had a decent sized team of co-founders, and we each wore multiple hats and played the role before we hired for it. So we kind of knew what was needed and could really feel when we were getting stretched too thin and needed to bring somebody in to own a particular area. And again, I think we could have done that faster in certain ways, but one thing I do think we did well is we didn't really take the kind of like hire fast, fire fast mentality. We were very thoughtful and careful with who we hired, and really took recruiting seriously. Like, we bring somebody in, we need to make sure it's the right person who's going to help us solve these problems that we're having trouble solving ourselves. Somebody who's better at this than we are and is going to move the business forward. And so we did a lot of sourcing as opposed to just posting a job and getting applicants. And we're also really picky about, you know, what we're looking for. When you're a small company and you just need one person in a role, you can afford to say, we're going to find someone who's done it before. Like, we're going to go get someone who works at a company somewhat similar to us that's further along, but they've come in and they've done what we're looking for before, and can bring a level of experience that we don't have. We really had to do that as a young founding team. We were all first-time founders and didn't have a lot of experience, but what we could do is make sure we brought in the right people with that experience. Yeah. And so we always, like, the first person we would hire into sales or client success or, you know, the clinical side, we'd get someone who maybe was a little bit more expensive, but had that experience, and could really move the ball forward in that area.
That's awesome. So, I know we've got 15 minutes left, but I'm sure some people will want to sort of gather themselves before 1 o'clock. So I want to start to wrap up. If there are any questions, people feel free to, you know, add it in the Q&A or in the chat. But Will, you know, kind of, I want the call to action, or I want to put a bow on this. Like, what's most exciting for you in the next, let's call it 1 to 2 years, and how can people, what are you looking for? How can people get involved?
So really big thing for us. We need to build out our product team more comprehensively. So looking for that director of product who can help us execute on our roadmap. We have a lot of really exciting ideas for how we can leverage technology to really scale a care manager's reach even further and help them reach out to the right patient at the right time, with the right intervention. So using, you know, some kind of algorithm, machine learning in our application to take all the data we have access to and prioritize patients for our care managers and for their outreach. So we've got kind of the workings of a vision for this, but bringing in people from a product perspective, from a data perspective, who can really execute on that is an incredibly exciting opportunity for us. So if anybody knows anybody with that kind of background, especially if they have experience doing that in healthcare, would love to get those types of individuals on board.
That's awesome. Well, thanks, Will, for joining Coffee House. Thanks everybody that's listening in. Stay posted. We'll shoot out another email blast or post on LinkedIn for the next Coffee House. As a matter of fact, I'll plug it a little bit here. I don't even have a date yet, but we actually are going to have Rye Walker, the founder of Astronomer, potentially on our next Coffee House, which will be fascinating. That's an amazing company. But TimeDoc is really, you know, it's been, you know, just heartwarming to think about like where we started, where we're at now. And for anybody listening that, you know, folks, this is a super exciting company. I mean, if the idea of helping 1 million patients a month doesn't get you excited, I can tell you there's a lot of value still to be created for employees and shareholders in this company as well. And just, you know, kind of mission driven, you know, we're really, you know, improving patient outcomes here. So great company, great mission, great team. It's in Chicago. You know, we have remote workers as well, but just a great culture to be part of. So thank you, Will, for joining, for sharing the story. I'd encourage folks to follow up with me, with Will, and look forward to chatting with all of you on the next Coffee House. Thanks, Will.
Absolutely. It was a pleasure. Thanks, Tim. Thanks, Rohit.
Thanks, everybody. Have a great weekend.
All right. Take care. Bye.